Madam Chair, my bipartisan bill, H.R. 5393, the Transparency and Fairness for Pharmacies Act, will take important steps to help rein in and bring more transparency to direct and indirect remuneration, DIR fees, and all pharmacy fees by pharmacy benefit managers, PBMs, that we've just heard so much about. It will require the Centers for Medicaid and Medicare Services, CMS, to create standardized quality metrics for health plans and PBMs to use when determining payments to pharmacies. PBMs often charge fees that are subjective to pharmacies based on how well the pharmacy performs. These performance measures, however, known as quality measures, are not always transparent and subjective. The pharmacies are forced to pay these fees that the PBMs put into place and say they have to do to perform better in order to stay within health plans networks. Those fees can be applied retroactively, sometimes many months after the drug is dispensed. PBM pharmacy measures that are unfairly applied against all pharmacies have contributed to over a 107,000% growth, 107,000% growth in pharmacy DIR fees, according to CMS, undercutting pharmacy reimbursements and increasing patient drug costs. Currently, PBMs use quality measures that are often unknown, unpredictable, inconsistent, and beyond a pharmacy's control, which then figure significantly into DIR fees pharmacies are forced to pay. Over time, PBMs have been allowed to operate virtually unchecked, leading to abuse of pharmacy performance evaluations and lack of transparency in pharmacy payments. My bill seeks to end these practices. This is one of the main issues I hear about when traveling throughout my district, and the importance to help correct the opaque system currently in place. One small pharmacy in my district, if they continue to dispense every medication for patients as they did in 2023, has a conservative estimate that they will pay up to $80,000 in DIR fees during the first 3 months of 2024. The amount this pharmacy must pay in DIR fees is more than they make, and they are worried they will have to close their doors if this issue is not addressed and addressed soon. These DIR fees have led to pharmacy closures all across the country and in my district as well. It is not just the rural community pharmacists that are hurting from this. Everything from independent to retail to specialty pharmacies are also hurting. This is one small step to bring more transparency and certainty to pharmacies when dispensing drugs, but lots of work is left to be done. I am encouraged to see that CMS will be implementing a new Part D rule targeted at pharmacies in January of 2024. The rule will require DIR fees to be assessed at the point of sale and hope to help mitigate these outrageous DIR retroactive clawbacks. While I think this rule is well-intentioned, I'm interested to see how the new rule will play out and if it will truly stop these clawbacks, while also monitoring the effect it has on patient premiums. We also need to do more to protect our pharmacies, and I would like to continue working with the committee on this specific effort to ensure PBMs can no longer undercut pharmacy reimbursement below the cost to acquire and dispense the drugs, forcing them out of network and many times out of business. I urge the passage of this bill and hope that all of us can continue to work together to provide the comprehensive reforms needed to protect patient access to pharmacies in their communities. And I yield back.
Gentleman yields back. Further discussion? For what purpose does Mr. Carter seek recognition?
Move to strike the last word.
Gentleman's recognized for 5 minutes.
Madam Chair, this important legislation I introduced to Representative Griffith would finally require CMS to establish standardized and relevant pharmacy quality measures addressing one-way PBMs have manipulated pharmacy DIR clawbacks and undercut pharmacy payments. I hope that all of us can continue to work together to provide the comprehensive pharmacy reimbursement reforms needed to protect patient access to pharmacies in their communities. Today, many community and specialty pharmacies are being reimbursed underwater, which is intentional to keep them out of the network, limiting a patient's choice of pharmacy, and this is simply wrong. There is bipartisan support for addressing this serious problem, and I was pleased to hear our counterparts on the Senate Finance Committee take action to address this concern in the PBM reform legislation they advanced last week. As you all know, pharmacists are one of the most successful healthcare professionals in America, with 95% of Americans live within 5 miles of a pharmacy. Pharmacists are among the most highly trusted healthcare professionals. People count on our training and expertise to stay healthy and informed. Yet PBMs are putting pharmacies out of business and removing patients' access to care. We know that 4% of all independent retail pharmacies go out of business every year. That's why I'm proud to champion this bill, which will support patient access to pharmacies, and I urge my colleagues to do the same. Thank you, Madam Chair, and I yield back.
Gentleman yields back. Further discussion? Seeing none. Question now occurs on approving H.R. 5393, and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Dunn. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Pallone. Pallone votes aye. Eshu. Eshu votes aye.
So many people.
DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Masui. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blount Rochester. Blount Rochester votes aye. Soto. Soto votes aye. Craig. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Chair Rogers.
Aye.
Chair Rogers votes aye.
Mr. Clerk, how is Mr. Curtis recorded?
Curtis is not recorded. Curtis votes aye.
How's Mr. Wahlberg recorded?
Wahlberg is not recorded. Wahlberg votes aye.
How's Mr. Crenshaw recorded?
Crenshaw is not recorded. Crenshaw votes aye.
How's Mr. Joyce recorded?
Joyce is not recorded. Joyce votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 44 ayes and 0 noes.
Ayes have it, and the bill is adopted.